This week on the segment, Menzies School of Health Research, Professor Alan Cass is in the house.
Great to be here, Chris.
No one ever says that. Ladies and gentlemen, welcome to the segment. I love these sessions. We get to talk to some of the best people in the Northern Territory, and today is none other than Professor Alan Cass. He is the Director of Menzies School of Health Research. Absolutely brilliant. Every Territorian has heard about Menzies, but today I want to welcome Alan, and we're going to hear about Menzies. Mate, really good to have you. Welcome.
Great to be here, Chris.
Really? Okay, we're going to get on our soapbox, have a bit of fun, solve all the problems of the world, so look out. Both of us have done our hair.
Essential.
So, mate, tell us, every Territorian knows about Menzies, okay? What is the business of Menzies?
Menzies opened its doors in 1985, so we've been here for 35 years. We want to do research that addresses the most important health problems affecting people in the Territory, Northern Australia and the region. We want to do practical research that has an impact. So we don't want to sit in an ivory tower inside the Menzies building. I want people who are doctors, nurses, community members doing research so that when we do it, it changes how we deliver healthcare and it changes people's health and well-being.
So look, you've actually got, probably an incredible job because you've got a staff of around 300 people, a budget of 50 million that you've got to balance to the penny in Parliament, I hear.
Correct.
So, and somehow you're a parent.
Yeah.
You're an incredible husband.
I hope so.
So obviously you spent many years. Tell me a little bit about Alan. Okay, we've got to get to know Alan, and then I'm fascinated to figure out how this researcher goes into a high-level businessman in the Northern Territory with phenomenal responsibility. Tell me about the early days of Alan.
So I was born in Sydney,
Yep.
went to school in Sydney and did medicine at Sydney University. My family was interesting, is interesting.
Families are.
Half of them are doctors,
Yep.
and the other half work in things like, some of them for government, but there are people who go to work each day and do operations or look after people, and there are other people, the other half worry about how do we do things that benefit the whole of society. So I started work in a hospital, Royal Prince Alfred Hospital in Sydney as an intern, a junior doctor in 1989. And then I began to do training over the next few years as a kidney doctor. And it was very clear we would fly out and care for people in Western New South Wales that too many people who had kidney disease needing dialysis and treatment were Aboriginal people. And I wanted to understand that. And I asked people there, do we know? What is the cause? Why do so many people affected by it? And I couldn't get any answers. And at the time I went home to my house in Sydney with my wife. Before we used to get lots of emails, we used to get letters in the mailbox.
I don't remember that time.
There was a letter in my mailbox from the Kidney Health Australia, which said there was an opportunity for PhD scholarships at Menzies School of Health Research in Darwin, looking at what was the cause and reasons for so much kidney disease in Aboriginal people. I went inside to my wife and said, we're going to live in Darwin.
We're moving.
She said, you're an absolute idiot. Of course we're not going to live in Darwin. But we contacted Menzies at the time, so I'd never heard of Menzies at that stage, and we came up for a visit. So this was in the early...
So did you have kids then?
We had one kid when we first came up, and so we came, we loved it. It was interesting. We came up to start my PhD, so I came to work here. This was in the late 1990s, and I worked as a kidney specialist then at the Nightcliff Dialysis Unit, and combined that with doing my research, trying to understand why there was so much kidney disease. We had twin boys who were born up here then. My wife also, I think this is very typical of many of us who come to Darwin and love the Territory. She came up, she was pregnant with twins, so it was hot and sticky and uncomfortable. And for the first year, I think you often struggle to adapt to being in the territory. But from about 12 months in, we were in love with the place and wanted to stay.
Tell me about the team at Menzies, okay? Yesterday having a chat with you, you're pretty fired up, you're pretty passionate about your team.
I am.
Tell me about the pillars, as quickly as you can, of the pillars of the business to Menzies, if that's possible.
When I came back 8 years ago as director, one of the things that I've always loved is the team who are there. There are people there who are world-class doctors, nurses and researchers who almost never blow their own trumpets. They come here, they love the place, and they're here to do work. What are the areas that we have? Our main pillars are a focus on global and tropical health, so conditions that impact us because we live here in Darwin, in the top of Australia, and people who live in countries around us. Child health, because there are such important issues that we need to deal with for young kids. Ear infections, hearing and learning, skin infections, all sorts of problems that affect kids themselves. Wellbeing and preventable chronic disease, that's my area. Kidney disease, diabetes, cancer, they're key areas of research. And one other area that we have a lot of work in is we have a centre for CCDE, for child development and education. So that looks at the intersection between health, education, all sorts of things that impact how children develop and lead their lives, and trying to understand what leads to good pathways through life.
And so that team makes up around about 300 people in there, broadly.
Correct.
Yeah.
So in the territory, with full-time, part-time, and also people we work with in communities, there are at least 300 people who work at Menzies.
That's incredible. Aussies are not great at promoting ourselves, but I want you to be as articulate as you can. What are we bloody experts at? What are we at the top of our game on a world stage?
There are some areas at Menzies and in the NT where we are absolute world leaders. Absolute world leaders. People will probably know of something like Nightcliff Gardner's disease, milioidosis, a bug that lives in the soil, and when it rains it comes to the surface because the water comes up, and people who might have skin cut or might have diabetes or problems can get severe infections.
Yep.
Bart Curry, a doctor at the hospital and a doctor at Menzies for 30 years, Mark Mayo, a leading Aboriginal scientist, they have built a team. We are the world's best in milioidosis research.
Awesome.
Over 30 years they've done work where we have a leading repository of information about everyone who's been affected by the infection. What we have materials stored in the lab so that we can understand what causes severe infection. We've driven changes in how we treat it with antibiotics so that many fewer people die. And we collaborate with people across the world to look at this infection. So that's one example, because you need a place like Menzies, because that is a problem here for people living in the top end of the territory, but you bring the best minds to address it in the hospital and in research so we get better health.
So you've got to help me here, okay? A little bit of humour. So my idea, a good mate of mine, Graham Webb, okay? He's got a coffee cup. I think that coffee cup's been on his actual desk for 35 years. At some stage in that coffee cup's life, it was white. My picture of researchers is like 47 cups of coffee, and they just, is that accurate or is that really wrong?
47 cups of coffee would explain me, yes. And perhaps for some people, they're most productive when their desk is covered in papers and cups of coffee with a bit of grunge on the bottom. That's correct.
So let me bring it forward, the context of chronic disease. Okay, right now the whole world is shut down. COVID, we've all been obliterated. But in context to, which is obviously very serious, but in context to possibly other diseases out there that we all don't know about, where does COVID sit in here?
It's understandable why the whole world is shut down in the context of COVID. We need to protect the community. It's an easily infectious condition and we need to do things to keep people well. Underneath, though, just as you say, there are many common chronic diseases that cause suffering and early deaths across the whole of the world. The most common causes of death across the world now are deaths due to chronic illnesses. Diabetes, kidney disease, cancer, heart disease. These are the problems that affect most of us across the community. What's really important with COVID-19 is that we continue to engage with people in the community to say you need to keep going to your doctors and nurses safely, but so that things like screening for breast cancer, that people managing their blood pressure, people with diabetes seeing their doctors and making sure they're getting the right medicines, they're following their diet.
Let me completely flip. So you've had a steep learning curve to become quite an astute businessman. So
I hope so.
Oh, don't worry, the NT News would have let us know, mate. You know how that works these days. If it bleeds, it reads. But obviously that's been a steep learning curve, learning to be, I guess, a $50 million budget with such a large and broad scope of works. How did you take that journey? That must have been an incredible learning.
I'm still learning. You need a good team, and there are many people I work with who are very skilled in finance, governance and all sorts of issues who I learn from and work with.
So we don't see you there with the calculator and another test tube. We don't see that.
But you're right. It's interesting when you look around the country and people like my role, they're predominantly researchers. So they're many of them doctors and scientists who've been successful researchers, but who probably, have shown a deep interest in thinking not just about their own work, but how do they support a broad workforce and try and do things that will really make a difference. For me, there are a few steps on the way which I think helped prepare me. You always keep learning. When I was at university in Sydney, for a few years I was president of the student union. That's not the political part, but the part at Sydney Uni that ran the restaurants, the buildings, the student societies and whatever. And I was the finance officer and then the president. It had hundreds of staff and a turnover of tens of millions every year. And I began to learn about overseeing a large organisation, doing budgets every year, working with people to ensure, you've got the right workforce and that you can address those things. I also was a member of the council or senate of the university. I got elected to that and got an understanding for that, a massive organisation, and how you would do things. I think also when you want to become a researcher, I had a role where I headed a large division of research of kidney and diabetes research at the George Institute in Sydney. So there I had 40 staff and a turnover of about 10 million, and you begin to grow your confidence in how you manage teams within institutions. For me, the chance to jump at coming back to Darwin, which I loved in 2012, and where I felt my skills and the ability to support a team doing work that is so fundamentally important, I jumped at that opportunity.
Tell you what we are going to do. We said we're going to have some fun. I'm going to put you in the hot chair, mate. All right. Now, Aussies, as I said, Aussies are not great at talking themselves up. So you better, I'm an honest opinion here, all right? So okay. 10 out of 10, all right?
Yep.
Where does Alan rank himself? Obviously, you spent many years in kidney research.
Yes.
Where would you put yourself?
As a kidney researcher, about 9 out of 10.
About a 9 out of 10. All right, you've got kids. This is a tough one. As a dad...
I hope I'm 10 out of 10. They may have a different view.
Okay, Northern Territory supporter. I think I know the answer to this. You're
11.
You're an 11 out of 10. Okay. Chef at home.
There'd be varied views on that. 6.
6, all right. Now, I work behind the scenes in gala dinners and I've seen you at many events, but, mate, I've never seen you busting any moves on the dance floor.
If it were negative, you'd have to score me. A 0 would be kind.
Okay. Football supporter. Are you a footy supporter?
I'm a tragic Sydney City Roosters supporter.
Oh, God help you. God, cancel it now. What about negotiating a deal?
perhaps people can criticise me that I try and see the good in everyone I work with, which sometimes people aren't always out for good who you're negotiating with. But I think I stick to my guns to try and achieve what I want for Menzies, so perhaps 8.
Good on you. And the last one, let me ask you this, okay. Big team, big budget, high profile position. Are you able to go home and switch off?
Mostly yes.
Yeah, you are.
I'm good at fighting with my 16-year-old son for the couch. The counter to that could be at times you wake up in the middle of the night worrying about things.
Yeah, I imagine
and that does happen.
So let me ask you this. How is our health as a society doing broadly? Because it appears like we're going backwards. Is that a fair statement?
That's a great question. In some ways, when you look in Australia, they say that about 1 in 3 women, girls born recently will have a chance of living till they're 100. So Australia, in international terms, generally does very well. Our life expectancy is high, a bit higher for women than men, but for both women and men, it's high. Now, there are things we clearly need to do much better.
Which are?
Well, for one, the gaps in life expectancy, health and wellbeing that between our Aboriginal and Torres Strait Islander Australians and non-Indigenous Australians have not narrowed. There is still profound challenges working with Aboriginal people, families and communities to identify solutions and ways of closing that gap. That is fundamentally important. And we also, like all countries, we're seeing more and more of people affected, and these are easy to say and hard to do, not doing enough exercise, not living healthily, still need to do work together to lower smoking rates, to eat well, to prevent all of these chronic illnesses, because we want people to live long lives but be healthy and active and able to do things, not to be unwell and having a poor quality of life.
So this is good because we are bombarded on the internet with every health expert, okay? And as in, there's an agenda, they're selling a videotape or a series or whatever it is.
Yes.
So what you're saying directly is, I think you're saying is that 100% looking after your health is critical to having
Absolutely correct.
It's critical.
And I think we've got a great opportunity here in the Territory at Menzies working with, we've got wonderful health services, services like Congress in Alice Springs, Danila Dilba here in Darwin, MeWatch in Arnhem. There is the opportunity for us all to partner to do the most innovative things working with community around approaches to best nutrition, to identifying health problems early and giving the best care so that people stay strong and healthy.
I've got 4 teenagers, and there's been a lot of discussions about the pressure on kids to get an ATAR.
Yes.
And I've got to give a good shout out to Dr. Doug Hardcastle, who's a good mate, but my son is dating his daughter, and so medical comes up all the time. But one of the things that comes up is that if you don't get this grade, kids can't go into have a medical profession. Are there any opportunities at Menzies for possibly kids or people coming out that don't get that ATAR?
The short answer is yes. Slightly longer answer is never give up. Great. If kids want to do medicine, get in research, science or other things, they should do it, because there are still some areas you have to get an impossibly high ATAR and then you can go straight into medicine. Yeah. But about half of the opportunities now in Australia are later entry. Yeah. And that means even if your ATAR was lower than you wanted, you might do something like at Menzies, for people in the Territory, we have now what we call, it's a centre, Ramachotti Centre, where we want kids who are interested in science and medicine and health, where we offer traineeships for kids. They can develop skills, they can work in our lab, they can work with our research teams, they can grow in their own confidence, and then that might lead to them going to university and doing a degree that goes into a medicine degree, if that's what they want. People should never give up at that chance.
That's really good. So ATAR results are here in about a week. So for those students that would be interested, where would they go?
They can look at our website, and I think something to do would be to Google the Ramaciotti Centre at Menzies, where young kids can find out opportunities for them to do things at Menzies and in research, science and health.
When I grew up in this town, there used to be this notion, I don't know if that's the word, but look, if you want real medical attention, you've got to go down south. Don't have any operations in Darwin. And I just remember it was this like epidemic, and people would fly south. I don't hear that anymore. You know what I do hear? I hear people that check into the private hospital, they all want to get over to public because that's where all the experts are. Now, forgive, I don't mean to step on anyone's toes, and I don't mean to draw any, but to me it says that that is long gone, that we have some of the best on the planet. Is that accurate?
I think that is accurate. We're still a smaller city and the territory than, so there are there are some incredibly specialised areas where people may need to go out, but I think that has changed. There are areas where we have absolute deep world-leading expertise: infectious disease, diabetes, kidney disease, general working on heart disease. The paediatricians here are a remarkable group of people who understand, and what's good about the people we have here, they live here, they care for patients and community here, so they're steeped in the health problems that affect people here. You won't get someone at the University of Melbourne who knows more about melioidosis or Nightcliff Gardner's disease than our people here. You won't get people in Adelaide who know more about diabetes in young people than Professor Maple Brown, who works at Menzies in the hospital, who has seen that explosion of diabetes in young people and is working with mothers and children to really change things as a senior doctor and researcher. So if we can attract and retain those people here, then we have the best people at Darwin Hospital, Alice Springs Hospital, to address our problems.
No, really great. But listen, we're going to finish up with a couple of, I always try and have a bit of a laugh at towards the end, mate. So I've already checked out that you're not a vegetarian. You know, I just don't mean anything by that. But, mate, you've got to tell me the 10 fast questions here. For you, where's the best place to get a steak?
Cooked on the barbecue on my balcony.
There you go. All right, I'm going to check it. I'm going to ask your wife, okay? Are you a fish? Do you get out to do some fishing, or you're probably locked in that room?
I love fish, but I'm not a fisherman.
I'll take that. Good. Favourite pub?
Not a pub person either.
Not a pub person, but I know this one you are. Coffee shop. You've got to have a favourite coffee
Nightcliff
shop.
Foreshore Cafe.
Okay, good, fantastic. Favourite place to visit? Because you do a bit of travelling around the NT. Where do you like visiting?
I've loved when I've got to Central Australia and to West Macdonald Ranges and places there. Off the beaten track, beautiful part of the territory.
And I guess here's the best question. I love asking this question, okay? Who is the easiest to employ, men or women?
I want people who have the right skills.
Don't be a politician.
And who work well with their colleagues. That's what I look for.
Okay.
There are too many people at times, people who are about just themselves and not working with others. They don't make good team members. The reason I have to be careful, 80% of Menzies staff are women, so I certainly can't say men.
You've answered the question. Do you know what? We ask that question all the time, and women are answered all the time. They are the easiest to employ. Every employee we've ever had. Amazing. But it's interesting watching people struggle. Hey, listen, tell me this. We are very, very lucky to have you up here in the NT. We really are. I think I was expecting, I don't know what I was expecting, Alan, because mostly I know everybody that comes onto the show. I've known it for a long time, but you're a humble, great leader. Obviously, your contribution is enormous. If there's one or two moments that Alan, not Menzies, but Alan could look back in his career and go, I'm very proud of that moment. Is there something that comes to mind?
Life or career? In life, it'd be my kids.
Beautiful.
I love them to pieces. And what I love is, perhaps they're brainwashed by their father and families, but for me, what's important in life, you know, you got 70 or 80 years on this planet, leave it a better place than when you arrived. Do something, bring your skills to help people, to, in my case, you know, to understand what causes ill health, to give people better care, to try and improve health and well-being. And I see that in my kids. You know, they've got 3 big kids at uni, one just starting work as a teacher. That's always been a passion. People have said to her, you did bloody well in your ATAR, why don't you do medicine? And she said, I want to be a maths and science teacher. From the beginning, that's what she's wanted to do, and she's just started her first full-time job, and she loves it. And I think that's fantastic. And similarly, you know, her brothers, who are both at university, coming up and working here. One's doing law. He's had placements with NARJA and with people here, loves it. He's working for a little while in a big company, and he sort of says, why do I do that? You know, the work that we do in the Territory is so much more important. For me, if I can have an impact on that in my family, but also in a way of working with people at work, so that people are there, so that they see perhaps a model of leadership that isn't about yourself, but is about how you as a team work together to have an impact, I'd be proud of that.
One thing I failed to mention is that you're also responsible for sponsorship and you're completely self-funded. Yes. So look, Alan's going to be at Bunnings on the hot dog stand this weekend, mate. Please give generously. Get 2 hot dogs. But mate, seriously, congratulations. You're a great leader. The ship that you lead out there is fantastic. The crew, you know, I can hear your passion and energy, mate. We're really privileged to have you up here in the NT. I'll get you out fishing one day, but all the very, very best. It's been fantastic having you. Thank you. Let's go and have a cup of coffee or 3.
We will.